Now we're going to move into the posterior part of the forearm. We're going to start with Extensor Carpi Radialis Longus. So notice up here we have a bulk of muscle tissue right between my fingers. That's called the wad of 3, and it includes the brachioradialis as well as the Extensor Carpi Radialis Longus and Brevis. The origination point for the Extensor Carpi Radialis Longus is off the lateral supracondylar ridge. It travels all the way down the forearm, and it inserts into the base of the second metacarpal. And its main actions are going to be extension of the wrist, as well as a little bit of radial deviation. So right away that sets them up actually into the muscle test position. It's important for this one that we're not just going globally across the back of the hand though. Make sure you do stabilize that second metacarpal while you try and bring them into flexion and out of radial deviation. Slowly load in and relax. Notice the muscle contraction all the way down the lateral side of his arm, coming into its insertion point right beneath my fingers. Hold there nice and strong as you try and pull his wrist towards the table. Now, of course, where there's the longest, we also have the Extensor Carpi Radialis Brevis, and that's going to go to the third base of the third metacarpal right here. Its muscle test and action is going to look very similar. Again, it's going to do extension of the wrist as well as a little bit of radial deviation, but now instead of stabilizing here, we're going to move over one digit and then try and pull him down into flexion like that. Again, we can palpate over this part of his forearm just to get that muscle contraction beneath our fingers each time we do it. The origination point for this one is off the lateral epicondyle coming down into the base of that third metacarpal, or the common extensor tendon.